Hi, this is Steve Rowe, Executive Director. Today is Wednesday, January 27th. I'm happy to tell you that we still have no positive COVID cases from any of our residents, and it's been at least 3.5 weeks since we've had a positive staff member test. So just a reminder, whenever we have if a staff member did test positive, that immediately puts us into what's defined by state regulations as an outbreak, and we need to then test residents in the health center on a weekly basis at a minimum. So it's really good that we haven't had any positive employees in the past 3.5 weeks, because that means that we don't have to test our residents, which is quite an uncomfortable thing, especially for the residents with dementia that really can't understand what is happening. So anytime that we don't have to test residents is a good thing. The case counts in Johnson County continue to decrease slightly. They're still above where we would like them to be, but as I updated the tracking worksheet just a few minutes ago, most recently the 14-day daily average is down to 37. That's the lowest it's been since right after Christmas, and we should see that trend continue downward for at least the next couple of days. The one thing that's concerning, many of you know, students came back to town. Classes started this past week, so there are some students back in town, and we may see a bump again in cases like we did back last fall. We're hoping that does not happen, but we'll just need to keep an eye on that for the next couple of weeks and see how that ends up. The positivity rate in Johnson County is also on its way down. It was 8.9% when I checked a little while ago. That means that we are required by regulation to test our employees just once per week. We have been testing twice a week, and we'll continue to do that just because we believe we're better, we're serving you better, and it just is more protection if we can catch a case earlier and not have that employee potentially infect anybody else. So we will continue to test twice a week, even though by regulation we would only need to do that once per week. A vaccine update for you. Today was another vaccine clinic. We did a bunch of employees, their second dose, and the second dose for our independent living residents who are 90 plus, and anybody else who lives in a household with a 90-plus-year-old resident. So that was about 60 residents that received their second dose in a clinic earlier today. Next Thursday, February 4th, there will be another clinic for residents who are 86 years old to 90, and some 85-year-olds, not all, but there were some 85-year-olds who received their dose 3 weeks ago, and their second dose will be next Thursday, February 4th. And then finally, it's like we will wrap up our vaccination cycle with another large clinic for all of our younger independent living residents. So anybody who is 85 and younger will receive their second dose of the Pfizer vaccine on February 9th. So I think that's 2 weeks from yesterday, if I am thinking correctly. So all of that is really good. What we believe to be true with the vaccines, what we've heard is that it takes a week after the second dose to reach its maximum effectiveness. So we'll be looking at basically mid-February to have our entire Oak Knoll community as protected from this virus as we are ever going to be. We will continue to wear masks, continue to social distance, because there is nobody at the CDC or public health that is recommending to change practice anytime soon. What we don't know, we still don't know about carrying the virus. Even though you've been vaccinated and can't really get as sick, you could still potentially be a carrier of the virus and infect somebody else. So we'll continue to do the things that we have been doing to try to keep people and those in our community as safe as possible. But starting in mid-February, a week after everybody will have received their second dose, we will start to look at relaxing some of our current restrictions. As an example, we are currently the dining room, we're allowing 4 residents at a table. We will start to perhaps go to groups of 6, maybe 8, but 6 most likely, so that you could share a meal with a slightly larger group. We'll start to look for opportunities like that would start to get life a little bit back more to normal for you. I think that's enough about COVID. I want to talk just a reminder that our business office has been working on tax summaries. Our practice for many, many years has been in the January 31st bill. You will get your annual tax summary for the previous year. So in that bill, be looking for a blue sheet of paper, and it will contain all of the tax information that you need to complete your 2020 tax returns. I promise you it will be there, and Lisa Chapman is busy stuffing envelopes with that information along with your monthly bill. So be looking for that later this week. I also want to follow up on some comments that I made at the resident council meeting last week, and that was related to exploring the possibility of having a daycare as part of our operation. So exploring that idea has been part of our strategic plan for the last couple of years. As we did that work earlier in the planning cycle, we really do not have any place on campus in the main building that would be an appropriate place to house a daycare. But we've had a house, Herb Jordan, as you know, died in December, and the house that the Jordans lived in, really, if we're ever going to consider moving forward with a daycare, that is probably the best location possible for that. So we have a team of people from our leadership team that are exploring that possibility, trying to come up with the plan for what that would look like. I had a board meeting this morning and gave our board members a heads up that it is something that we're exploring, and there does seem to be a favorable reaction to the idea of trying to figure out a way to add daycare into our service. There are a couple of potential benefits to the Oakville community from that if we can figure out how to make it work. First and foremost, from an employee retention and recruitment standpoint, it would certainly be something that sets us apart from other long-term care communities in the Iowa City area. If we had that as a potential benefit for our employees, that they could drop their kids off at daycare just right across the street from their workplace, potentially go spend some time with them over their lunch breaks, that type of situation is certainly attractive from an employee recruitment and retention standpoint. The second benefit would be the opportunity to provide intergenerational programming with young kids working with or being in the same space and doing activities with some of our residents. So it is something that's like there's just some tremendous opportunities there if we can figure out a way to make this work. So that team is working on it, and by either the February board meeting or the March board meeting, we will come to our board with a proposal for how we would envision this and how we can make it work, and we will see if we get support for that idea. Again, seems to be support right now, but we need to make it work, and it's got to work financially for us as well. It cannot be something that is a drain on the Oaknall community. It needs to at least be able to stand on its own. So just wanted to let you know that that is something that is being worked on. And finally, I just want to encourage you, if you have any questions that you would like Kim Burden-Jackson or me to address in future weekly video updates, please just send us a note, drop an email, call me, anything, but we want to make sure that these are valuable for you and answer any questions that are on your mind. I think that's it for today. Thank you. Bye.